again as Connie.
Okay. I am M Mavikana Nkuna. I'm a breastfeeding activist. Almost all mothers can breastfeed, no matter what the size or the shape of their breast. There are practices that can make breastfeeding difficult. So they are from the health facilities as well as from the families. So from the health facility, it will be lack of support and also negative statements from the healthcare workers may cause mothers to lose confidence and interest in breastfeeding. I know there will be some health workers who will say, it doesn't work. A baby will be breastfed exclusively for 6 months. I know that will never ever work. You must mix feed. And if there's one thing that is even more dangerous, is mixed feeding. If you decide you are not breastfeeding, rather not breastfeed. Not to say I'm breastfeeding, but then you in between you give a formula, yeah. So it's either exclusive breastfeeding or exclusive formula feeding, unless there are such reasons. And then another thing that make it difficult is the delayed initiation of breastfeeding, not starting within the first hour after delivery. Separating the mother and the baby is also another problem. Giving formula to breastfed babies, limited knowledge and skills of healthcare providers, birthing practices such as the use of analgesics or painkillers, and a lack of larger facilities. You find that the mother cannot be with the baby, so those can be a problem. And in the family, the benefits of expressed breast milk should be discussed with the family, because in most times those who are remaining with the baby will say, no, I cannot handle human milk. And then you ask yourself, why can't you handle human milk when you can handle cow's milk and goat's milk and other milks? What's different then? You find that it's an attitude of whoever is going to remain with the baby. So it should be discussed with the family, especially the grandmothers. They are the ones who will say, no. When you are at work, the only thing that can do is using a breast milk substitute, because no, you cannot touch a human milk. Swahili.
Okay, so we can put that breast milk in a bottle when mom is at work, or
it's better to use a cup feeding. It works better, so and it's also easy to clean.
So is it safe to use cup by the father?
Yeah, it is, and they find it more workable. In fact, in the hospital where I worked first, where we had babies, the government will also stock those cups for us, which are graduated in milliliters and what. It works perfectly well, because even the prematures, we use cups.
Yeah, I would love you to emphasize that point, because there is this thing that babies, again, they say they get confused. Mothers are at work and then we give the food with a bottle. Some babies, when you give, you offer breast after tasting the bottle, they don't want to know anything about the breast. They just want to stay on the bottle. So that is a very important point to emphasize, that it's important to give them with a cup so that they're not confused for the teat of the bottle and the teat of the breast. Yeah, I think it makes sense.
Yeah, that's very true. That's what we call nipple confusion. So the babies have that confusion.
Yeah.
That there was something, now there's something rubbery, then they become confused.
Yeah.
So it might also contribute to failure or problems with breastfeeding. So another thing, if you are not comfortable in front of family members, that can also cause problems. You have to, breastfeeding should, as you were saying, it should be natural, and babies should be breastfed wherever there's a need. You don't have to go and hide somewhere to breastfeed. So fluids or herbal mixtures and over-the-counter medicines given to the newborn babies to clean their systems before breastfeeding are not necessary, and they may damage the stomach. Sometimes solid foods, as I already said, are introduced too early because the family believes that the baby is not getting enough milk from the breast. And again, they will say the baby is colicky because the baby is hungry. So we have to negotiate and discuss consequences of these cultural practices that and they may that may encourage the separation of the mother and the baby. So another practice and perception can be by the mother's lifestyle, whether the mother might be smoking cigarette and feels that, no, I cannot stop my cigarette. I can rather not breastfeed, because we know that smoking is also linked to lower milk production. So mothers are just advised to, to stop and give up smoking when they are breastfeeding. So mother's lifestyle, again, it could be again, the mother should avoid alcohol completely, because alcohol will pass into the mother's milk and then is subsequently taken by the baby. So some mothers who feel, I cannot leave my glass of wine or what, they might sacrifice breastfeeding their babies for alcohol. So mothers are just advised to do that, and we have to motivate them. Mothers not breastfeeding at night, sometimes we find that the mother will say, Mina, I want to sleep. I'm not going to breastfeed at night. And you know, the milk production, that like the prolactin, is more active at night. That's where most production of the milk happens. So that also can make the mother to stop breastfeeding. So mothers really need to be encouraged, because in most cases, I feel we as health workers, we are failing our mothers to breastfeed, because they go through all the systems from the time when they're on antenatal care, they go to the hospital, and then there's postnatal care, but we fail them. So as health workers, we should know our facts and also encourage our mothers to do this lifelong saving method of feeding. So sometimes mothers' previous experience find that with the first baby, the mother had cracked nipples, engorgement, all those because the mother was not taught correctly how to position and how to attach the baby to the breast. So those again should be information should be given to them. Sometimes people will say, I won't breastfeed because I'm HIV positive. So for now, that's not an issue. If you breastfeed exclusively for 6 months, because they also get those antiretrovirals for the baby and the mother. So there's no risk of the baby, if you do things correctly, of the baby having transmission of HIV/AIDS. So again, there's this feeding of the baby during the separation. That is when the mother goes back to work. So breast milk can be expressed the baby can be given expressed breast milk, which can be put at room temperature for 8 hours and in the fridge for about 3 to 5 days. In the deep freeze, I believe it's about 3 months.
Yeah. Some say 6 months.
Yeah, it can be up to 6 months, but that I have to verify. I know the fridge is 3 to 5 days, and then the room temperature, it's 8 hours. So the baby can be fed, as we said, using a cup.
Yeah.
And it doesn't. You don't have to, because some mothers will say, "No, I cannot express because I can't afford a breast pump." You don't need a breast pump. There are techniques that we teach mothers on how to express manually using their hands, and it works wonders. In fact, for me, it works more than the breast pump.
Yeah. I've seen some mothers who do in those situations that when they use a breast pump, nothing comes, but when they use hand, like,
and manually, we've got a lot of things that we teach them manually. You can even use warm up a bottle, can be a peanut butter bottle or something that you have cleaned, and then you can also put it around the breast. So there are so many methods that will aid without a breast pump, and they work more than the breast pump, from what I've observed. So babies can still be fed when the mother goes back to work. So let's really encourage breastfeeding at all costs.
What is the wetness? You mentioned something about wet nursing.
Oh, wetness. Wetness is like, okay, if we go back to the Bible, you know, when Moses was born, and then he was found by, was it Pharaoh's daughter?
Yes.
Yeah, and then she wanted the baby, and then they have to look for someone, because isn't it babies were being killed during that time?
Yeah.
For someone who had a baby.
Okay.
So there's someone who had a baby. Obviously, that someone can breastfeed.
Oh.
Then it's if someone else, not the mother,
okay,
feeds the baby. Although now we have the risk of HIV, it's not very much encouraged. But if you know the status or whatever, and when as you are asking that, I can also indicate that we've got a concept that we say it's relactation. Like you find that the mother has decided, because of no support, to give the baby a breast milk substitute. And then after getting all the information, the mother feels, I'm leaving this. Maybe it's after a month after giving the baby, and I want to breastfeed. So we do assist the mother to relactate, like go back to breastfeeding. As the baby suckles, and then lactation resumes again.
I remember we used to do that in hospitals those days, that giving other mothers to breastfeed other people. And there were stories where we heard that a grandmother started breastfeeding her grandchild because the mother was not there, and as the child kept on sucking, the milk came out.
It's very true. You can breastfeed, Scone.
Yeah, so milk, it will be stimulated. If someone sucked there, it will actually come out, you know.
That's very, very true.
Yeah. So,
very true.
You know, there are some situations, again, where you find fathers, don't laugh at this one, you know, jealous for the baby sucking their boobs. there are those situations, do you find that, because I've heard people saying, no, I can't breastfeed. This is only for my men. And their husbands as well, that are really cautious about their women's breast, that no, can't let the baby keep sucking the breasts. Do you find those situations where the father is fighting with the baby for breast?
Yeah, that's why it's very important. I think what is being done now, it's good that the father is involved from pregnancy through everything, and sometimes even goes to classes with you, and the father is involved, because even as mothers, we start denying the father. You become so close to the baby and deny the father to come nearer to the baby. If the father is part of, the father will be the one who will take the baby skin to skin for an hour and so and so. But things are evolving. I think this generation is kind of practicing.
Yeah. Because as you're saying that, on our previous video, we were talking about how people protect infection for those neonates. So we mentioned that some cultures, they don't allow fathers anywhere near the baby, for the first 3 months. And others were saying, not 3 months, 6 months. We are missing out other points for those babies, So,
very true.
No, thank you. This was very much interesting. And to understand that little things that we thought we know.
I'm also the victim of that. I thought I knew everything, so we really need to be updated.
So that is very great, and thank you so much for all that information. And people, if you want to know more about breast and breastfeeding, Mrs. Nkuna is here. And if you want to get connected, get hold of Nkuna Elder, comment down there on our YouTube channel, and then ask more questions. And then you can still carry on aiding, because there are so many things. This is just a drop. I understand the way she said it. She said there is a lot about breastfeeding that we can carry on, and you might have some more information. So just add it up there on the comments. So stay blessed and have a lovely day for today. Please, even if you feel you are a grandmother, you don't breastfeed, send this video to your daughters, in-laws, grandchildren, and so on, so that we benefit our new generation. Bye for now.